Can acne treatment make the condition worse? Well, it's all about selecting the right treatment for your acne condition and understanding the treatment that you're using and what the potential side effects could be if it's not used correctly. In our previous video, we talked about the various types of acne treatments available, ranging from oral and topical medications to therapies. If you missed that, click on the button on your screen now to watch that first. In our video today, we will be diving right into the potential side effects of medications used for the treatment of acne and how we can manage or prevent that from happening. The type and the strength of the medications are key contributing factors to the experiencing of side effects and the types of side effects as well. Let us now look overall at the type of side effects that we might anticipate when starting a range of oral, topical, or even external treatments. Some of the common side effects include dryness and irritation, redness, photosensitivity. You can also experience things like gastritis or reflux. There can also be a worsening of the skin conditions such as purging when starting medications. In rare situations, some of the more uncommon side effects include developing an allergic type reaction, and the symptoms of this would include things like redness, rashes, hives, eye or lip swelling, as well as shortness of breath. Prescription medications such as oral isotretinoin can also be associated with more severe side effects such as teratogenicity or birth defects when a pregnant woman is exposed to this medication. It can also cause liver inflammation, or what we call transaminitis, in some rare groups of patients, and also it can give rise to an elevation in your cholesterol levels like your LDL levels. How do we manage the side effects of acne medications? It is important to understand that when it comes to the treatment of acne, both topical and oral, sometimes side effects can come in before we can see an improvement in the overall condition. It is common to actually have acne purging when starting retinoids either topically or orally. Let us now look at how we can manage some of the most common side effects associated with acne medications. Well, one of the most common side effects will be skin dryness and irritation. This can come both from the use of topicals as well as oral medications. Typical topical medications that are used for acne include AHA and BHAs, retinoids, as well as azelaic acid, and they can all cause skin irritation if used inappropriately. The other mainstay medication, oral isotretinoin, can also cause skin irritation due to its drying effect as well. Secondly, there's also the issue of having a stomach upset or gastric reflux from the use of certain oral medications, typically of the oral antibiotic class. The typical antibiotics utilized, like doxycycline, can give rise to a stomach upset. The way to avoid this would be to have this only after a full meal, have a full glass of water when ingesting the medication, and to sit upright for at least an hour after ingestion. Thirdly, there is the increased risk of developing blood clots as well as increased blood pressure with the use of certain medications, namely the oral contraceptive pills that are utilized for the treatment of hormonal type acne. Lastly, how can we manage more severe side effects such as transaminitis, elevation in your lipid levels, as well as teratogenicity that is associated with the utilization of oral isotretinoin? The safe way to do this is always to do baseline blood tests to first determine whether your liver enzymes are normal to begin with, along with your cholesterol levels. It is then useful to repeat this again 5 to 6 weeks later to make sure that the utilization of oral isotretinoin doesn't give rise to an elevation on liver enzymes as well as cholesterol levels. This will then allow the physician to pick up as early as possible any patients that might develop such complications and terminate the use of this medication early. It is important to also avoid the utilization of this medication in women who might be trying to get pregnant. Always ask your patient if they are intending to get pregnant or are sexually active, and make sure that they do have protection and understand the risk of taking such medications should they get pregnant. It is also key to make sure that a woman doesn't plan pregnancy for at least 3 to 6 months after stopping the medication as well. It is important to report any side effects that you experience to your dermatologist, including mild or persistent ones. Your dermatologist will then be able to adjust your medication if needed or provide you with an alternative treatment plan. We talked about the side effects of acne medications and how to manage these side effects in our video. Click on our subscribe button to watch more up-to-date dermatological content and drop a comment below if you've got a question for us.